Hello dear students, I am Dr. Muhammad Assam, lecturer of neurology, Faculty of Medicine, Ain Shams University. In this video, I'm going to show you how to examine the state of the muscle and tone around joints. At first, you should greet your patient, introduce yourself to him, explain the procedure and take his permission. ازيك؟
ازي حضرتك؟
اخبارك ايه؟
الحمد لله.
انا دكتور محمد عصام مدرس الاعصاب.
اهلا بحضرتك.
استاذنك افحص حضرتك؟
اتفضل.
تمام. When examining the tone, I should ask the patient to be relaxed. لازم تبقى مريح خالص يا محمد. خلاص رخي رجلك خالص وسيب رجلك خالص وانا هفحصها. تمام. When examining the state of the muscle and tone around joints, we'll start with the lower limb. So I'm examining three signs. I'm examining for any atrophy, hypertrophy, or fasciculations. So I'm doing inspection. So I'm seeing if there is any guttering in the dorsum of the feet, if there is any atrophy around the chain of the tibia, and I can make a palpation. Okay, and I also can make a palpation of the muscle to feel the muscle bulk. Normally, muscles would feel hard and firm and bulky. If there is any atrophy, the muscle will feel soft and small in size. Then I will look for fasciculations, if there is any fasciculations, but fasciculations should be sought in the proximal muscles. So I should do more exposure with the patient and to see if there is any fasciculations in the proximal muscles of the thigh. And if there is no fasciculations, I can elicit them by making a tapping movement on the muscles to elicit the fasciculations, like this. Okay. Then I will go to examine the tone around joints. We will start with the tone around the ankle. At first, I should do unlocking of the proximal joint. So when I'm examining the ankle joint, I should do unlocking of the knee joint. And I will do it by two ways. At first, I will do a shaking movement, side to side shaking. Okay, and then I will do a passive dorsiflexion and plantar flexion of the ankle. And also I shouldn't forget to compare this to the other side. So I should do the same on the other side to side shaking, and then the passive movement, dorsiflexion and plantar flexion to examine the tone. Then around the knee, and also comparing this to the other side. And then around the hip, I should do a circumduction movement of the hip and comparing this to the other side. Also in the hip, you can do a rolling movement to see the tone around the hip. You can do a rolling movement to see if there is any hypotonia or hypertonia. In the upper limb, I should also start by inspection. So I am inspecting the hand for any atrophy in the sener or the hyposener, and also for any guttering. Then I am doing inspection of the forearm and the arm muscles to see if there is an atrophy or hypertrophy, and I can also do palpation of the muscles to see the consistency and to feel the consistency of the muscle. I can also do measurement of the circumference. For example, if I am trying to measure the circumference of the arm, I can take a reference point. So for example, I can take the olecranial process as a reference point, and using a measuring tape, I can measure about 10 centimeters from this point, and then measure the circumference by the measuring tape, and comparing this to the other side by the same way. I can also look for fasciculations, if there is any fasciculations. As we said in the lower limb, we should do fasciculations mainly in the proximal muscles. So I should do exposure of the biceps, triceps, and the deltoid, and see if there is any fasciculations. And if it's not found, I can do tapping on the muscle to elicit them. Then I'm going to examine the tone. As we said in the lower limb, if we're starting distally around the wrist, I should always do unlocking of the elbow joint and do side to side shaking, and also asking the patient to relax himself. ريح نفسك خالص يا محمد، سيب نفسك خالص. I'm doing side to side shaking, and I can also do passive movement, and also comparing this to the other side. Then around the elbow, I should do the examination of the tone more rapidly, and then around the shoulder by circumduction movement. So to conclude your findings as regarding the state of muscle and tone around joints, you should account if there is any atrophy, hypertrophy, or fasciculations, and the distribution of these signs. It's found in any muscles. And also regarding the tone, you should comment if there is any if there is any normal tone, or there is any hypotonia or hypertonia. Hypertonia it's mainly two types. It's rigidity or spasticity, and if it's spasticity, you should account of its clasp knife spasticity or not. And the distribution of the tone findings, if it's found around only distal joints or distal and proximal joints. Thank you.